I think a lot of doctors are at risk of making one of the biggest career mistakes of their lives, and they don't even realize it. And the thing is, I almost made the same mistake as well. Yesterday, I was talking to one of my junior doctors, and I asked her, so what specialty would you want to do in the future? And immediately, without thought, she said, definitely not renal. So I asked why, and she said, it's because I am constantly chasing bloods, I'm chasing requesting scans, answering bleeps, writing discharge letters, and I'm rushed off my feet all day. And you know what? When she told me that, I completely understood. Because years ago, if I was in her position, I probably would have said the same thing. But the thing is, she was describing the job as a house officer or as a junior doctor and not a consultant. They are very, very different things. A consultant job is completely different from a registrar job, which looks very different from a house officer job. I think a lot of us are at risk of making decisions on a 30, 40-year career based on a job they've only done for a few months. And that is a mistake. And the flip side to this is that many doctors actually choose their specialties based on their rotation experience. Now, I've sat on interview panels for intensive care and renal, and I often hear candidates tell me, I want to do intensive care because I love procedures. Now, there's a funny thing. I've seen candidates actually get marked down slightly for this. Because the reality is that as a consultant, we hardly do procedures. And that statement actually is a misrepresentation of what being a consultant in intensive care actually is. And it's important to know this, especially those of you who are going to apply for specialties. So what should you do then to make sure you make the right decisions? And this is a framework that I would recommend, which just consists of 4 very simple steps. Now, number 1 is, do you actually enjoy the science of that specialty? Then the second thing is, do you enjoy the case mix, the patients that are involved in the specialty? Third thing, do you enjoy the decision making that consultants actually have to make? And the last thing, would you actually enjoy the consultant lifestyle that comes with this specialty? What this means is that if you're interested in that specialty, you need to go and speak to the consultants, and you need to ask them 3 things. Number 1 is, what do they love about the specialty? Number 2 is, what does their week or month looks like as a consultant? And the third and most important thing is, what do they not like about the specialty? What is their pet peeves about the specialty? And believe me, everyone has their pet peeves in their specialty. It's important that you find out what that is. So do not let a 4-month rotation decide your 40-year career.